Hello students, this is Dr. Shraddha Mishra and today we'll be talking esophageal diverticulum. So it's a very important topic for your surgical postings, for the pathology and also for the radiology. What is an esophageal diverticulum? So as I have written here, it is nothing but an outpouching of esophageal wall. It is nothing but an outpouching of the esophageal wall. So this is how definition of esophageal diverticulum or any diverticulum is given. So if this is the wall of the esophagus, if there is a protrusion from the wall, it can involve all the layer or it can involve few layers, but in both the cases it will be known as esophageal diverticulum. So what are the different types of this diverticulum? These types can be divided on the basis of various factors. For example, depending on the development, any disorder can be divided into two types. You know that it can be congenital or it can be acquired. So same here also, esophageal diverticulum can be congenital or it can be acquired. So acquired esophageal diverticulum are more common than congenital ones. Second way of classifying them is based on their mechanism of formation. Okay, so they can be formed due to two different mechanisms. One is traction. So they are known as traction diverticulum, and another is pulsion, excess pressure, known as pulsion diverticulum. If this is the esophagus tube and fibrosis is going on adjacent to the wall of the tube, then ultimately it will pull up a part of the esophagus. This fibrous band will pull up a part of the esophagus and ultimately it will lead to formation of a diverticulum. This is traction esophageal diverticulum. Another way of formation is the pulsion, excess pressure due to neuromuscular discoordination, due to weakness of the wall. So if this wall is weak or there is a discoordination, then ultimately there will be outpouching of the wall from the weak points. So this is known as pulsion diverticulum. Two different types of the esophageal diverticulum. Third way of classifying them is based on the location. There can be three different kinds of esophageal diverticulum. One is pharyngoesophageal. So as the name suggests, it is situated in the pharyngoesophageal part of the esophagus. Second is mid-esophagus and third is the epiphrenic diverticulum. So based on the location. And fourth way of classifying them, so let's see with the help of diagram first, that if there is a protrusion in the uppermost part, it is pharyngoesophageal, protrusion in the mid esophageal part and protrusion in the esophagus part which is lower 1/3, it is known as the epiphrenic diverticulum. So fourth way of dividing them is based on the layers of the involvement. All the layers can be involved in the esophageal diverticulum or there can be only involvement of mucosa and submucosa. So it can be of two types, true and the false. True esophageal diverticulum will contain all the layers of the esophagus and false will not contain all the layers. So what it will have? It will have only mucosa and the submucosa. Example of the true diverticulum is the mid-esophagus diverticulum. Example of the true is the mid-esophagus diverticulum located in the mid-esophagus, and this is due to the traction and it will have all the layer. An example of the false is the Zenker diverticulum. Example of the pharyngoesophageal is again Zenker diverticulum. Mid-esophagus, as the name suggests, it is a traction. It is situated in the mid-esophagus. Example of the traction is diverticulum is again mid-esophageal diverticulum, and pulsion is the Zenker diverticulum. So now we can see that Zenker diverticulum comes so frequently, followed by mid-esophagus diverticulum. So let's see our next topic, which is Zenker diverticulum. It is situated in the pharyngoesophageal part we have seen before. It's a pulsion diverticulum. It's an acquired diverticulum. So many features we have already seen. Let's sort them out. First, it is a acquired diverticulum, so it will present later in the life. It is false one, so it will not have all the layer. It's a pulsion diverticulum. It means it forms due to excess pressure and muscular discoordination. And this is associated with the old age where the muscle will be weak, diabetes mellitus where there will be neuromuscular discoordination will be there. So concept of Killian dehiscence is very important. They will ask you in your viva, and if you know the Killian dehiscence, then you know the Zenker diverticulum very well. What is Killian dehiscence? In the inferior constrictor muscle, there are two types. There are two types of fibers. One fiber which is placed obliquely is thyropharyngeus. Obliquely oriented fibers are the thyropharyngeal fiber, and transversely oriented fibers are the cricopharyngeal fibers. So thyropharyngeal and cricopharyngeal. So if you look at the diagram carefully, at the center there is a potential small space. This potential small space is known as Killian dehiscence. It is known as Killian dehiscence. It's a small space, and if there is a excessive neuromuscular discoordination, if there is a muscle weakness, there is a obstruction in the lower part of the esophagus, then because of the excess pressure, mucosa and submucosa will protrude out and it will form Zenker diverticulum. So Zenker diverticulum will come out through this Killian dehiscence. So this concept is very important. Let's see images related to this topic. Friends, can you identify Killian dehiscence here? These are the oblique fibers of the thyropharyngeal muscle. These are the transverse fibers, and in between there is this potential space known as, yes, Killian dehiscence. And from this Killian dehiscence, this protrusion is coming out. This is known as pharyngeal diverticulum, also known as Zenker's diverticulum commonly. Barium swallow image of the Zenker diverticulum. Upper part of the esophagus, pharyngeal part, and this is the protrusion. Protruded part is obstructing the esophagus from behind. Okay, because Zenker is located posteriorly, so it will obstruct the esophagus from behind. That's why there will be obstruction in the passage of food. It will lead to accumulation of 2-3 days old food in this pouch, which will be causing halitosis, which will be causing aspiration. There can be respiratory distress, there can be lung abscess, various complication of Zenker's diverticulum. Again, after all the barium has passed, still there is a contrast in the Zenker diverticulum. Most common clinical feature of Zenker's diverticulum is dysphagia. You can guess it from above that if there is an obstruction in the esophagus, it will cause difficulty in swallowing. If there is accumulation of food, it will cause halitosis, and ultimately this food will regurgitate. So regurgitation of the 2-3 days old food, and aspiration. Investigations for the esophageal diverticulum. Barium swallow is very important, very useful, and you have seen the picture above that how it will look like. Manometry to rule out all the esophageal dysmotility disorders, because usually diverticulum are associated with the dysmotility. Treatment Treatment options depend on the size of the diverticulum. If size is very small, then we will go for only diverticulopexy. If it is large, then we'll go for the diverticulotomy. We'll do the myotomy and we'll remove the diverticulum in the diverticulotomy. And for the medium sized, we do Dolman's procedure, which is a very important procedure for your exam point. They will ask you what is Dolman procedure, then you have to say it's an endoscopic procedure in which two limbs of endoscope are placed differentially. One limb is placed in the esophagus, another in the diverticulum, and a staple is applied in between so that there is an anastomosis in between the two different tubes. So this is Dolman's procedure done for the medium-sized esophageal diverticulum. So this was all about Zenker's diverticulum, its barium swallow image, clinical feature, surgery. Now we'll go to our next topic, which is mid-esophageal diverticulum. So as the name suggests, they will be present in the mid-esophagus. And what is the most common type? There will be traction from the fibrous band. It will involve all the layers, etc. So let's write them down. It's a true diverticulum. It is more common in the right side. It's a traction type. Traction means pull from the outside. If this is the esophagus, some fibrosis process is going on in the nearby location, maybe due to lymph node inflammation, maybe due to some fibrosing diseases, maybe due to silicosis. So this fibrosis is going on, and this fibrotic band is going to pull the esophageal wall, and ultimately there will be formation of this diverticulum. So fibrous band, whenever you'll see the word fibrous band, fibrotic diseases, then you should go for the traction type of the diverticulum as your answer. And traction type are most commonly seen in the mid-esophagus. Example is silicosis. In silicosis you have fibrotic bands. So this is mid-esophageal diverticulum, a small one, mid-esophageal diverticulum. Barium swallow image. Let's move quickly to our next topic, which is epiphrenic, above the diaphragm. As the name suggests, it is epiphrenic or above the diaphragm diverticulum. They are usually false and they are usually pulsion type. Okay, so they are usually false type of the diverticulum. False because it will contain only mucosa and submucosa. Pulsion because they are due to excessive pressure and they are associated with the hiatus hernia. So this is all about epiphrenic diverticulum. It is not that important. Just remember its image. You can see in the lower part of the esophagus there is a big protrusion happening. There is a big protrusion. This is stomach and this is the diverticulum. So this is epiphrenic diverticulum. Remember all those images: epiphrenic, mid-esophageal, Dolman's procedure, Zenker diverticulum, barium swallow, and concept of Killian dehiscence. Thank you.